Hello everyone, today we will start MRCS OSCE anatomy mock, but before we starting, I'm just giving you a quick orientation about the MRCS OSCE and the way you pass. Some people pass both knowledge and skills. Some people pass only knowledge. Some people have the chance to fail both of them. And this is not great, I know that. And for them, they have a lot of struggle to pass MRCS OSCE then after. Why? Because there are some, not secrets, but tips and the tricks. Okay, so they expect you to be a registrar level and they want you to be working without prompting. What is the meaning of prompting? If you have done a CST or ST3 training recruitment interview, you will understand that you will lose marks when they prompt you. For example, if I asked you how to manage this case and you just give me the answer in the beginning in one single sentence, quick orientation about your answer. For example, this patient, okay, you examine patient with crisp and you have the idea that you need to have a CT abdo-pelvis for this patient and you will start sepsis 6. So don't try to say, okay, this is abdominal sepsis. And he will say, okay, what is then? What's next? Don't wait for the examiner to give you the answer. And this will make you lose marks for what's called prompting. Okay? And when he said, what else? This means that your answer is deficient. How to avoid what else scenarios? Believe me, it is all about your preparation, not something else. It's not about lectures, not about notes. Some people pass without lectures, some people pass without notes, some people pass with just doctor exam, but trust me, it is single resource and your own preparation. Okay, so don't let the examiner prompt you. And this is involved in ST3 interview, in core surgical training interview, in even the normal NHS interviews. So this patient is acute abdomen. I will manage him according to care of the critically ill surgical patient protocol. I will start doing ABCD approach. They know that you know the ABCD approach, but what exactly you are going to do? So abdominal sepsis, so I will use care of the critically ill surgical patient protocol ABCD approach. I will try to identify the key issues that I have, seek more information, ensure the patient safety. I will start my initiative by sepsis 6 bundle of having lactate, bloods for full blood count, use and ease, LFTs and CRP, and ABG, like including lactate. I will have cross group and save, bloods for group and save, and have a urine culture, blood culture, and I will give oxygen if needed, IV fluids, broad spectrum empirical antibiotics. I will ensure that the patient is having no drug allergy for these antibiotics. This is called the sepsis 6 bundle. And then after, I will have ECG, chest X-ray for the patient, read lactate, check if the CT abdo-pelvis with contrast will be needed. I will ensure that I will have the eGFR of the patient, and I will have, I will ask about contrast allergy. While I'm resuscitating the patient with IV fluids antibiotics, I will order the CT abdo-pelvis with contrast, and I will escalate to other senior members of my team, other relevant teams, and I will talk to the primary surgeon, on-call consultant, and I will ensure that all my team supported and competent for management. Also, I will have the rule of reflecting on this event to learn from events and mistakes. Now you have followed what's called SPIES. SPIES is a system of following the answer of any clinical scenario in normal NHS interview, in OSCE oral exam for MRCS, and in ST3 interview and in CST interview. You should have a system. So you will have 10 minutes station each. And as I said before, I will say it again, you will be divided throughout a long day course into two long day exam, two groups. The first group is knowledge, okay? And the second group is skills. And please note that these knowledge stations will be only 3: anatomy, pathology, critical care, and the skills will be 4: examination history, procedure skills, and communication skills. Okay, so once you have knowledge, you will be only having knowledge until you finish all of your stations. If you have 2 anatomy stations, will be together, and you will go through, for example, it will be a door here for this room, a door, and a door for this room, and you will have a chair, you will sit here and wait for the bell to ring. Once the bell rings, then you will go through in front of the door to read a sheet, and this sheet you will read it in 1 minute of the 10 minutes station, and then you will go inside having your card with you to the examinee, to the examiner, and you will introduce yourself to the examiner. In just he will take all details from your ID, bracelet, or neck ID. Okay, then you will go and start 9 minutes. In knowledge, the whole 9 minutes will be for asking you questions. I will not go deep this time, but I will zoom into anatomy, okay? Next time, I will zoom into, okay, anatomy. Next time, I will zoom into next stations, okay? So, okay. So we'll have the anatomy now, and I will not continue this module of how everything and this will be managed in the hands-on and next stations. Now we will zoom into anatomy, and anatomy stations will be 2 or 3, okay? And I'm not worried about anatomy. Anatomy is the easiest marks collector, okay? You will harvest most of the anatomy marks with you in knowledge. But next time, I will show you why some people fail in OSCE pathology, why some people miss the critical care, all stations. It's not about management plan. It is about management of patient issues, organization issues. You should be a registrar level. You should know how to escalate, how to communicate, how to support your team, even if it is not communication skills, it is a clinical scenario in critical care. But now we'll zoom into anatomy, and luckily anatomy is very nice. Why? Because as you see here, I, as Royal College, will be very nice with my candidates and having very nice exam. How? The exam will be very nice. How it will be? First, divided into bones, okay, bones, and the bones will be followed by joints, musculoskeletal, muscles, nerves, vessels, including arteries and veins, and then subcutaneous stuff, triangles formed by these muscles, whether it is deep or superficial, then the skin, dermatomes, and motor. I hope you understand what I'm saying. So, for example, in the anatomy station, I will start the anatomy station with simple question about bone. What is this bone? Then next, I will ask you, is it right or left? Why? Can you articulate with other bones, rename them, and enumerate these bones? What is this type of joint? Why this joint is not stable joint? What is the type of this joint? And then I will ask you about muscles arrangement in a diagram. And then after, I will ask you about triangles or hiatuses or whatever. And then I will ask you about nerves, nerve injury, and then arteries or vein, and then the structure of the subcutaneous and cutaneous stuff, which is skin, including dermatomes and everything. So dermatomes are inevitable question and always will come into your exam. And as I said before, it is all about your level, how to answer this anatomy question. And you should be oriented and expecting that the questions will follow in a systematic manner into bone, joint, muscles, areas, regions, nerves, artery, vein, and the skin, and dermatomes. I hope you understand, and I hope you know that this is what is happening. Okay, for example, this part here will be asked simple in your exam, and they will detect if you are able to identify this joint or not, if you are able to articulate the bones together or not. So you need to understand that anatomy is the easiest way to pass MRCS. And again, I'm saying, so as we said, it is all about your knowledge, and it is all about your ability to identify from A to Z in the anatomy. And you will have, for example, 9 minutes and 15 questions anatomy, or 20 questions anatomy. You need to finish all of them. How? By answering very quick questions. Very quick answers. Why? Because the examiner will not prompt you. We don't need to be prompted. If you don't know the question, just proceed for the next. Why? Because simply, when you have a question and you couldn't answer, you will come back later and say, oh, I can't know, so 1 minute left. Oh, I don't know, I'm just thinking, can you help me, sir? This will make you lose the following 5 questions that you will be able to answer, but you already lost the time, and there will no be time for you. Okay, so my recommendation is to have a good idea about how to do it, and do it very relaxedly. And I'm sure you are going to manage. And again, I'm just confirming that it is all about you, not the preparatory material or anything. Okay? Anyone got any question at that point? At that point, anyone got any question? Can you raise your hand? Can you raise your hand and ask me any question? So can you ask the question again, Fariha? Can you ask the question again, Fariha? Okay, yeah, I unmuted you now.
Yes, sir. Sir, that you have mentioned that there is a specific way to answer the question, that is spice. So we will not get prompted.
Exactly.
So can you elaborate more about that?
It is all about the material you study with. For example, if you study with our course material, you will just need to have this answer. For example, why shoulder joint is unstable? Don't say because shallow glenoid cavity. Now I will say what else. So I'm prompting you to add questions. So the trick is to keep the answer very, very precise, very quick, not to prompt you. For example, if I prompted you to answer what else, what else, what else, I will not give you the mark of the question. Do you understand what I'm saying now?
Yes, sir.
So you need to have a specific answer in a specific time, nothing more. I don't need to exhaust you, and you don't need to exhaust me. You should have a specific answer. Okay? So, for example, I will start now by elaborating with anyone who studied anatomy, Dr. Arya or Cedra or Sujan, Tajul, Taron, Vamsi. I will ask you the same scenario as the same scenarios as in your exam. So I have 20 questions in upper limb, and I will ask you one question followed by another, and I will show you what mistakes they did in this real exam. Anyone? Anyone studied Anushka, Nair, Arya, Shadi, Haider, Kino, Mustafa, Nazanin, Rush, Tajwal, Taron, okay, Fariha herself, okay? I need people who studied in order uh, to go with them in this mock. This mock means that you studied. So I will ask questions that they've been asked loads of time in your real exam before, and you should tell me what this and what that and how to do this. Okay, so anyone is ready? Anyone is ready? Nazanin, have you studied? Are you ready? Fariha, are you ready? Okay, Dr. Arya, I'm happy. Okay,
Yes,
Arya.
sir, I'm ready.
Okay, Fariha and Arya.
Yes.
Okay, Fariha and Arya. Okay, Fariha and Arya, you are together one to encourage each other. We will try it single and then we will multiply. So again, the same questions from the exam will be the same notes which is distributed all over the world. Some people say this is notes of our course, and some people it is the same of records, and we handled it into many course material. And if you are not convinced with your colleague who studied with you from his notes since 2018, you don't need to trust anybody else. You just trust yourself and find the material and do it with yourself. You don't need me, you don't need anyone. Okay, so simple. I will isolate this one. No. Okay. So I will isolate this one and ask you, Arya, about single question. Arya, what is this bone?
This is the clavicle, right clavicle.
This is a clavicle. Okay, it is clavicle. We don't know is it right or left. Okay, it is a clavicle. And what this bone forms, which joint this bone forms?
Anteriorly, it forms the sternoclavicular joint, and posteriorly, laterally, it forms the shoulder joint.
Shoulder joint. What is the type of shoulder joint?
The ball and socket joint.
It is what?
Ball and socket. Am I
Ball
right?
and socket. Any other names?
Synovial.
I will open the chat for everyone.
It's a synovial joint. Is there any name? I don't know, sir.
You said ball and socket joint, okay? What is the other name of ball and socket joint?
I don't know.
Okay. Arya, Fariha, what is the other type of joint? Any one of you? Yeah, ball and socket joint means what?
It's a synovial joint. Right? Is it, sir?
Yeah, spheroid, ball and socket, synovial joint. Spheroid, ball and socket, synovial joint. Okay, that's great. And is it right or left and why? Is it right and left or left and why?
This is right clavicle, right side one.
The right one. Why?
Why? Because the smooth surface is has to face anteriorly, superiorly, almost under superiorly, and the flat area should face on the lateral side, and the rounded end has to face anteriorly.
Okay. So you knew that it is now right one. So how to know is it right or left? Do you know that? How to know? So you need to define right or left. Okay, so you need to define the following. First, you need to identify what is the medial side, what is the lateral side features, what is the superior and inferior surface features, and anterior and posterior. So anterior and then posterior. Okay, so you need to identify at least medial, lateral and medial, superior, inferior, anterior, posterior. One single feature. You don't say, oh, we can't. No, it came to my exam and it wasn't available in any book, and I haven't watched it, and I haven't said I don't know. This came to my exam in 2018. Okay, so simply superior is smooth, inferior is rough due to attachment of ligaments. Okay. Medially, it is locking the medial 2/3, which is this one. Okay, this one locking anteriorly, medial 2/3. Okay, and lateral 1/3 is directed or concave or whatever, convex posteriorly. And we said superior is smooth and inferior is rough. And this end, what is the feature of this end? You have sternal end and acromial end. So the sternal end is, what is the feature of this end?
It's more rounded.
Excellent, it is more rounded, and this end is more flattened. Excellent, okay, that's great. And how to articulate this bone with the other bones? Do you know how to articulate this bone with the other bones?
Yes.
Yes,
Through ligaments.
Not ligaments. Articulating means you will put this bone with two other bones. So the examiner will give you the scapula and the humerus and will ask you to articulate them. How to articulate them?
In the glenoid cavity.
So simply you will have the acromial end with the acromion process of the scapulae, as you see here. Okay, here, and you will be given the humerus. So the humerus will be articulated with the glenoid cavity, and this will form the shoulder girdle or shoulder joint. Okay, next question is, why is that shoulder joint a stable one? Yes or no?
Yes.
Is it a stable joint?
No.
Not a stable joint. It's not one of the
No.
stable joints. Why it is not a stable joint?
Because shallow glenoid cavity and then a lack of support inferiorly because of the quadrangular space. And yes.
Yes, what? What else? I prompted you now, so you will lose marks.
Because of the shallow glenoid cavity, and there is little support inferiorly because of the presence of quadrangular triangle. Yes, sir, I only know the 2 points.
Okay. Okay, so you need to study and continue. That's fine. So is it Fariha or Arya? It is
Arya.
Arya. Okay, Fariha, do you know why this joint is not stable?
Sir, there were static and dynamic causes.
Excellent.
In dynamic causes, there was insufficient traction in between the muscles, or in unequilibrium tension in between the muscles, while in static causes, static is shallow glenoid labyrinth, and articular conformity is reduced, and there was negative intra-articular pressure, while dynamic has there was no synchronized contraction in between the muscles or rotator cuff acting to stabilize it within the glenoid and increase capsular tension. So that's why.
Excellent. Thank you so much. Okay, so if I put the muscular stuff here, okay. Okay, after adding the musculature, I'm asking you about some triangles, because you said because of the presence of the hiatus and the quadrangular spaces, and you said that. So can you point on this? On this screen, I will give you the remote control area. I will give you the remote control to tell us where is. Now you have the remote control, and the mouth is all yours, okay?
Okay.
And now you will point to the triangular interval. Where is it?
This is the triangular interval.
Where is the triangular interval? You have the mouse is all yours.
This is the This is the triangular interval.
Yes, excellent. Thank you so much. That is the triangular interval. Which structures are in this triangular interval?
The radial nerve, then the radial nerve and the posterior circumflex humeral artery.
So
yes.
profunda femoral, profunda brachii artery, and radial nerve. Excellent. Can you point to the quadrangular space?
Just superior to this is the quadrangular space.
Okay, and what is this muscle name?
Superiorly, it's the teres minor.
Excellent, thank you. And what is the inferior one?
That's the teres minor, major, teres major.
Excellent. So minor is above, and major will say I am major, so I am humble, so I will come below. That's good. Okay, that's good, good, good. So this is a teres major, and this is a teres minor, and that is a quadrangular space there. It is here. Thank you, Arya. And how could you tell us the contents of the quadrangular space?
The quadrangular contains the axillary nerve and the posterior circumflex femoral artery.
Thank you so much. That's great. So in triangular interval, radial nerve profunda brachii artery, and in the quadrangular, in this triangular interval, and in that quadrangular space, square space, this one, you have axillary nerve will come around the axillary neck. With it will be posterior circumflex humeral vessels. Excellent. And where is the triangular space, not interval?
It's here. So.
Thank you so much, Arya. So you used, this is a triangular space, sorry, clear all, that's it. Okay, this is the triangular space, will contain what?
It's a radial nerve and the profunda.
Just single structure in the triangular space, circumflex scapular artery. Nothing. Circumflex scapular artery. Okay. Now we will add some extra stuff, and you will be asked to tell us where and what are the branches of each vessel. Okay.
Okay, I'll try.
Okay. Okay. So at the outer border of the first strip, there is a vessel here. Okay. Do you know what is the name of this vessel?
Subclavian artery continuation as the brachial artery.
What is the name of it again?
Axillary artery. Sorry, it's the axillary artery. The continuation of subclavian artery. This is the axillary artery.
Okay, and what are the branches? You said axillary, that's fine. So from where it will start and from where it will end? Beginning and end of this artery.
It begins just after the first strip.
So beginning, you said outer border of first strip. Okay, right? Okay, and
what's it?
What is the end of it? What is the term? So where it will end?
It just ends at the axilla, just behind the pectoral minor. I'm not sure. I'm sorry.
Anyone? Okay, who is the next one? Fariha, who is the next one?
Yes, sir. I guess, as far as I remember, it's the beginning of the teres major muscle at the when it comes in front of the teres major, it continues as a big N. Okay.
Okay. Anyone knows? Anyone from the attendee can raise the hand and let me know. Because simply, I need you to be very, very active. When I put something on the group or at any place, please do it. Because I will not every time tell you what to do. Not every time. You are old enough and not young. So again, I will say it for the last time. So the origin of the axillary artery, okay, it is a continuation of subclavian. Okay, yes. Will start on outer border of first strip and ends on lower border of teres major. Okay, I send it to the group. Okay. Okay, it is part of the new license. Please keep it by your heart. Okay, this is for the upper limb mock, and I need you to have the arteries in your mind and everything. And afterwards, I haven't finished yet. I will go down take you down as an examiner. I will take you down to what's next, okay? To the structures of this arm and forearm, okay? And you should at least enumerate everything, okay? You should at least enumerate everything in the muscles, okay? So this is the most superficial layer, okay? Do you know what is the name of this muscle area? Or 1 minute. Okay, I'm taking you now down and asking who is available, raising hand apart from Arya and Fariha. So again, it is structure, sorry, it is region. I asked both of them in the upper limb, okay? Guys, I have interview after 5 days, and I'm totally respecting every one of you. And you have the full notes, the full material. Why you leave, join? I'm not that free, but I'm respecting you and joined you, so don't leave. If you don't join from the beginning. Don't try me, okay? I'm not for trial, and I'm not free, but I do respect every one of you. If you want to leave, that's fine. If you don't participate, that's fine. Believe me, without swearing, I have my interview after 5 days. And I did much effort that costed me to resign from the job and a lot of stuff. I know it's not your mistake, but it's not my mistake to add a lot of stuff every time, update you about how. So if you want to leave immediately now. If you want to continue. Don't leave. I'm just having, like, for example, opening the door and some people going up and down. I don't like this. If one single one, I will give him all my efforts and we'll do it together. And some people at the end of the day will say, oh, we haven't attended lectures. Where is your lectures? I'm here and I'm respecting 200, only 20 of them attending. Okay? So as
Mr. Reda,
yes.
hi, sorry to disturb you.
No.
Could you go back to where you started initially, where you were explaining the blood, the vessels that are running on the muscle, and then you were asking about the muscle. I wasn't sure what your question was there. Thanks.
Okay, about the artery, where is the artery will start and where is the artery will end? I will add it to you now. Okay, I will show it to you what I mean. Okay, just, yeah, I will. Are you ready to answer, Nazanin?
I'll try. I've got the book open next to me.
That's fine. That's no problem. It is important to answer. It's not important to struggle, you know. So where is the axillary artery beginning and ends? Do you know where is the beginning and end of axillary artery? Are you, Nazanin?
So I know the axillary artery is divided by pec minor to its 3 parts.
But where it will start and where it will end?
So you mean the first part, the second, and the third, you mean?
No. The artery beginning, you have always landmark for beginning and end of each artery, right?
I remember this was in part 1, actually. Is
No,
it so beneath the
look at the group, you will find very single lecture, very simple and single picture. The axillary artery will begin as a continuation of subclavian artery as the outer border of first strip and will end at the lower border of teres major. That's the axillary artery. Branches, you have what are the branches of axillary artery? And yes, it is divided by this muscle into 3 parts. First part above, second part behind, third part below. And that's, if I remove that one, this muscle here will be ending the artery below the lower border of teres major. Okay. So what are the branches of the axillary artery? Do you know?
So you have the mnemonic, screw the lawyer, save a patient.
Okay.
First part is superior thoracic, is behind the pectoralis.
Okay, superior thoracic, yes.
Second is thoracoacromial and lateral thoracic. These are
Excellent.
behind the pectoral. And third part is
Anterior posterior, anterior posterior.
oh yes, anterior posterior circumflex humeral and subscapular.
Excellent, thank you so much. So as you see here, this is the branches, anterior posterior, yeah. So anterior circumflex scapular, posterior circumflex, anterior circumflex humeral, posterior circumflex humeral, because it will be surrounding the surgical neck of the humerus. So it is circumflexing, and the below the scapulae, subscapular, this branch. Okay, so now we finished a region in the upper limb and the whole station's upper limb. As an examiner, should I stop here? No, I will continue. Take you down to the arm, take you down to another region, which is anti-cubital fossa. Okay? Asking you about what is this region called, what is the boundaries, what is that, what is that. So I will take you down until we finish. So, Nazanin, what is this region called?
Cubital fossa.
Anti-cubital fossa. What are the boundaries of these fossae? What is the boundaries of this fossa? What is the boundaries of this fossa? Anyone knows?
So medially you have the Pronator Teres.
So Ihsan and Sujan, I open the mic for you. Say again.
Hello.
Where is Nazanin?
Hello.
Yes. What is the anti-cubital fossa relations?
The base will be formed by an imaginary line which joins both the condyles,
Excellent.
the medial and the lateral condyles.
Yes.
Then medially will be the Pronator Teres
Yes.
from the medial epicondyle, and from laterally it will be the Brachialis.
Yes. Excellent.
The contents would be the medially would be the median nerve, then the artery, brachial artery, and then the biceps tendon.
So which one is most medial?
Median nerve. Most lateral will be the tendon.
Okay, so tendon,
Artery, nerve.
then artery, then nerve, tan. So tendon laterally, artery in the middle and medially, and nerve most medial one, isn't it?
Yes.
So from lateral to medial. Why? Because simply you will palpate the brachial artery just medial to the tendon. Okay, that's great then. And what else is the relation? What is that one? Do you know what is that one? What is this?
Over there we can see the cephalic vein which comes laterally,
and what
which
is
will
this?
have the median cubital vein, and then it will join to the basilic vein which will come medially.
And what is that one? What is this yellow one? White one? It is bicipital aponeurosis. So the biceps muscle will have a tendon. Where is the tendon of the biceps attached?
Radial tuberosities.
Radial tuberosity. And is it a main flexor or base supinator?
It is a main supinator. The
Excellent,
main
thank you.
flexor will be
Because
brachialis.
Brachialis.
Excellent, thank you so much. So because simply if I show you the movement of the muscle, you will be seeing that this is the radial tuberosity. Okay. I'll show you. Okay, this is the radial tuberosity. Okay. And in that radial tuberosity, you will have the attachment of the bicipital tendon. Okay, where is the attachment of the brachialis? Anyone knows?
Brachialis will be attached to the ulnar tuberosity.
Ulnar tuberosity, which is?
Here.
Yes.
Yes, excellent, thank you so much. So And that's why the brachialis is main flexor, but the biceps is main supinator. Excellent. That's very nice, because you understand now that here is the radial tuberosity is attachment of biceps, and it is main supinator, but here is the attachment of the brachialis, and it is a main flexor because it will flex. If you can see here, the joint of the elbow joint, you will see that this is the ulna, and here will come the yeah, 1 minute. Yeah, this is the ulna, the ulnar, the olecranon process, and here is the main flexion. I can move it, okay? And I'm very glad that you know this information. I will take you down about a diagram. I will give you a diagram in the forearm about muscles arrangement here. Okay, anyone knows the arrangement of this area? I will show you. I will show you. So you should divide your brain into superficial and deep stuff. Every single muscular plane should be divided into superficial group and deep group, or at least compartments, like the leg compartments. Okay? And this is the anatomy exam, is always like that, okay? And I will show you the presentation immediately, but we need to finish first from that one, okay? So do you know then what is this muscle called?
Biceps.
Okay, that's biceps. What is that muscle?
That might be brachialis.
That one? Short head of biceps, and that one is
Long head of biceps.
long head of biceps. And what is under this muscle is?
Brachialis.
Brachialis. Brachialis, excellent. Arrangement of the muscles of the forearm, if I showed you like this and asked you about this muscle, the most lateral one. Okay, that one. What is the name of that one?
Flexor.
Yes, yes, brachioradialis.
Radialis.
Brachioradialis. Excellent. And what is that? What is the arrangement of these muscles? This one in the anti-cubital fossa, nearest one.
First will be the Pronator Teres.
Pronator Teres. Excellent.
Flexor Carpi radialis. Then Palmaris
Flexor
Longus.
Carpi
Then
radialis.
Flexor Digitorum. Flexor Carpi Ulnaris.
And then, no, just single one. You said Pronator Teres, Flexor Carpi Ulnaris, right? After, sorry, Flexor Carpi radialis. And after this is, you said Palmaris Longus. That's excellent. That's super excellent. Palmaris, this is the Palmaris Longus. You can see it will come with a small sheet to the palm, Palmaris Longus. And what is next is?
Flexor Digitorum superficialis.
No, just wait. This is this one. Ulnaris. No, Ulnaris. So it is excellent now. So we have flexor. Sorry, this is Pronator Teres, Flexor Carpi radialis, and Palmaris Longus, next one, and then Flexor Carpi Ulnaris. Okay, that's good. Okay, so we can now unexpose this part, and we can minus this layer, and we'll see next muscles. What is the name of this one?
Fossa digitorum.
Still the radialis. We can hide this radialis to see what is next. What is that one?
Fossa digitorum profundus.
That is no, still superficialis. Digitorum superficialis. You will say, Reza, what is the importance of these muscles? Yes, it will come in your exam, sir. Okay, this is the superficialis. I will hide the superficialis. What's next to the superficialis is
Flexor
profundus.
digitorum profundus.
This is a profundus. And what is that one?
Pronator quadratus.
No. Deep one.
Flexor
It is
Flexor
profundus.
pollicis longus.
Yes, thank you so much. Flexor pollicis longus.
pollicis longus.
Excellent. Thank you so much. So profundus, and this is a profundus, this one, flexor digitorum profundus, and this one is
Flexor pollicis longus.
flexor pollicis longus. What is that one? It's easy one. I will show you. This one. Thank you so much. Supinator.
Supinator.
And that one, we will hide it now. This one, I'm showing you. Extensor Carpi radialis longus, but that one will come on the back. Okay, will not appear here. It should be appearing when we go to the back. Okay, so the back again, I will add all muscles and come to the back of forearm. Okay, don't lose anatomy marks. Okay, don't lose anatomy marks. From the brachial plexus questions, all will be from your study. Okay, so this is the back now. We can handle it like this. Okay, and we'll come like this and ask you about each one. What is that one, small one? The triangular small one? Anconius. Okay, this is a common extensor origin. What is that one muscle? That one? Extensor Carpi ulnaris. Extensor Carpi ulnaris. We are on the back. We are on the back. This is the triceps, long head and short head. And this is the flexor Carpi ulnaris muscle. Extensor Carpi ulnaris. Okay. Next to the extensor Carpi ulnaris, what is that muscle?
Extensor digitorum.
Extensor digitorum. Single, 2 words. Extensor digitorum. What is the name of that one?
Extensor carpi.
Brevis. Extensor carpi radialis brevis. So this one is
Extensor
carpi ulnaris muscle.
ulnaris.
Extensor carpi ulnaris. But that one is radialis brevis.
Brevis.
Okay, this is the radialis brevis muscle, and that one is radialis longus. Okay, so again, if you come back to the back, you will find Anconius. Okay, after Anconius, flexor carpi, extensor carpi ulnaris muscle, and then what is that one?
Extensor digitorum.
Extensor digitorum, and what is that one?
Extensor carpi brevis.
Extensor carpi radialis brevis,
Brevis.
and that one extensor
Carpi radialis longus.
longus muscle. Okay, and we are here from the front. Don't forget, this is still brachioradialis muscle, from brachium to radium, brachioradialis muscle. Okay. Oh, the arrangement is difficult. If you just read it twice, you will never forget this arrangement. Just twice. Okay. If you have any objection, let me know on the group. The group is open for all objections. If you have no objections, that's fine. Okay. What is this muscle called? The deep ones. Now I hided some muscles. The deep ones. What is that one called?
Extensor pollicis brevis and abductor pollicis longus.
No, you should orient yourself first. So this is the thumb. Okay, I'm asking you about this. Abductor pollicis longus muscle. Abductor pollicis longus muscle. Abductor pollicis longus muscle. Again, abductor pollicis longus muscle. This one from above. Above abductor.
Yes, sir.
What is that one? Still we are supinator one. Okay, so supinator is still there, and here is above one after supinator abductor pollicis longus. And what about that one?
Extensor pollicis longus.
Excellent, excellent. Thank you so much. Extensor pollicis longus. And the in between the longus is brevis.
Brevis.
So 3 muscles here and 1 below. Above is abductor pollicis longus muscle. Below it directly is another longus, is extensor pollicis longus muscle. In between is extensor pollicis, but brevis.
Brevis.
Excellent. And the lowest one is extensor indicis muscle.
Extensor indicis.
Indicis or indices, whatever you will say. Okay. So I need you to be oriented about every single question in your anatomy. Okay, about the dermatomes of the upper limb. Dermatomes of the upper limb. Okay. Anyone can orient us about the dermatomes of the upper limb? Anyone?
At the level of the shoulder, it is C4.
Okay.
Then outer part of the lateral part of the arm is C5. Thumb is C6. Middle finger is C7. Little finger is C8. And the medial part of the hand is T1.
Okay, I will show you very nice diagram that you will never forget. And I always confirm that dermatomes of upper and lower limb are inevitable in your exam. Inevitable. It will definitely come to your exam. So I will show you everything. Okay, so now I will show you how to study the dermatomes, and you need to understand that the head and neck is divided into 3 dermatomes actually, okay? In head and neck, you will have maxillary, you will have from above, mandibular from below and around the eye ophthalmic, and this is the trigeminal, apart from what is called the angle of the mandible is supplied with C2, C3, okay? Great auricular nerve C2, C3, okay? Apart from the angle of the mandible, the head and neck is all supplied by the trigeminal. Then above, then after C3, it will come here, and then around the clavicle and above the clavicle, it will be C4, and then C5 around the jugular notch, and mute, okay? And C5 will come to the shoulder, and C5 will be coming down, and C5 until we finish and come to this point. This point can be, I will call it C6, okay, with medial part of forearm, and then middle finger is C7, okay, and then C8 lateral 1.5 finger, and then still C8, which is here. C8 is forearm medial part, and then T1, and then in the armpit, it will be intercostobrachial nerve, T2, around the armpit. Then you will come here counting after C5 in this bit, T1, T2, T3, in the nipple line T4, nipple line T4, nipple line T4, then T5 until the umbilicus 5, 6, 7, until the umbilicus is T10. So this is the dermatomes of the upper limb, and I don't like to divide your brain with this. It's not necessary, to be honest. I need just you to be oriented as I'm showing now, okay? From here, okay? And I will annotate it for you to just give you the best idea about this one, okay? Okay, so this is C5, C5, then C6, okay? Then C7, middle finger, okay? Then here is C8, then T1, then T2, intercostal brachial nerve, okay? So dermatomes are inevitable and it will come to your exam. We'll repeat this mock for lower limb and head and neck tomorrow, and I need you to attend tomorrow as well. Anatomy is very important. Okay, thank you so much. I hope you enjoyed, and please keep studying and keep updating, and you keep studying. Thank you so much. Hope you enjoyed.